Hi everyone, welcome to the 53rd seminar presented by the Centre of Research Excellence in Aphasia Recovery and Rehabilitation, and our first one for 2025. I'm Dr. John Pearce, postdoctoral researcher at the Aphasia CRE and co-facilitator of this series along with Dr. Rebecca Sullivan. First up, I wanted to acknowledge the traditional owners of the lands where we live and work across Australia. I'm speaking to you today from the land of the Boonwurrung people of the Kulin Nation, and we pay our respect to elders past, present and emerging, and extend our respect to any Aboriginal and Torres Strait Islander people joining us today. Today we're going to be hearing from Dr. Claire Bennington about her work co-designing a blueprint and operationalisation plan for an international aphasia awareness campaign. I'm going to introduce Dr. Bennington in just a moment, but before I do, for anyone who hasn't joined us on one of these seminars before, please submit any questions you have for Claire using the Q&A feature in the Zoom toolbar at the bottom of your screen, and just avoid using the chat for questions or they won't be seen. You're welcome to submit questions at any point during Claire's presentation, and this feature also allows other participants to like or upvote the questions they're most interested in. So I'll prioritize the most popular questions when we begin. We've reserved some time at the end of the talk to address as many as possible. If you can just keep your questions fairly brief and focused, and avoid submitting comments. Okay, it's now my pleasure to introduce today's speaker, Dr. Claire Bennington. Claire graduated from City University London in 1990 and has more than 30 years experience working with adults with acquired communication and swallowing disorders in a range of clinical settings in both the UK and Australia. She's been a leader of speech pathology services for over 20 years, and Claire has always had a particular interest in aphasia. She completed her Master of Science in Human Communication again at City University in 1997, and her research looked at the impact of aphasia on spouses. Claire's the current chairperson of the Australian Aphasia Association, having been the deputy chair for 3 years, secretary for 16 months, and general board member for 11 months. And Claire recently completed her PhD, which had the overarching aim of co-designing an international aphasia awareness campaign that was through the University of Queensland, Australia. She took up the challenge of this PhD because of the frustration she'd experienced throughout her clinical career and her time on the AAA board due to poor understanding of aphasia, and wanted to try to address that problem. So Claire, I'll hand over to you to hear more about that.
Thank you very much, John.
Oh, I think that's the wrong, that's presenter's
What are you seeing there? Oh, very sorry.
It's all right. People are very much used to this these days.
What have we got now?
That's it.
Great.
Thanks, Claire.
All right. Thank you very much, John. Thank you for that introduction and for this opportunity to present my PhD research, which, as John just said, had the overarching aim of co-designing a unified international aphasia awareness campaign. I'd also like to start with an acknowledgement of the traditional owners of the lands on which we meet, and the Wurundjeri people, who are the traditional custodians of the land where I live in Melbourne. I pay my respects to their elders past, present and emerging, and extend that respect to other Indigenous Australians. I would also like to acknowledge my wonderful advisory team, Associate Professor Sarah Wallace, Associate Professor Yuda Isaacson and Dr. Kira Shiggins, and my research advisors with lived experience of aphasia, Emma Beasley, who's a person with aphasia, and her mother, Kim. So this is an overview of what I will cover in this presentation. I'll start by outlining my experience and motivations for this project, as well as the experiences and motivations of my research advisors with lived experience. I'll introduce patient and public involvement, provide some background about aphasia awareness, explain the rationale for this research, and describe the research plan. I'll then summarise the 3 international studies that comprise my PhD, and I'll share some reflections on Emma and Kim's involvement as research advisors with lived experience throughout this PhD. I'll then provide a critique of the final campaign blueprint and finish with a summary of the overall limitations and contributions of this work. So in this section, I'll outline our experience, motivations, patient and public involvement, background information, the rationale for the research, and the research plan. So as John said in the introduction, I'm a UK-trained speech and language therapist, and I have more than 30 years' experience working with people with aphasia in the UK and Australia. I've worked with people with aphasia and their family members in the acute, subacute, and chronic stages of recovery in acute hospitals, rehabilitation centres, and community settings, including their own homes. I've also been on the board of the Australian Aphasia Association, or AAA, for nearly 7 years, and I'm currently the chairperson. Back in 2020, I responded to a Facebook post about this PhD opportunity on aphasia awareness, as the topic really resonated with me, and poor aphasia awareness had been a frustration throughout my clinical career. Some of my reasons included always needing to explain what aphasia is to people when talking about my work, often needing to advocate and fight for people with aphasia to get the speech therapy input that they needed, needing to explain what aphasia is and its impact when applying for grants for the AAA, and raising awareness of aphasia is a core purpose of the AAA, but it is challenging and it requires time, effort, and resources, including campaign materials and funds, all of which are limited in an organisation run entirely by volunteers, and often the impact is indiscernible. So I took up the challenge of this PhD to try to do something about it. Fundamental to this research has been the involvement of 2 people with lived experience of aphasia on my main advisory team. Emma, who has aphasia following a stroke in 2016 when she was 33 years old, and a lawyer working as a judicial associate in the Family Court of Australia, and her mother, Kim. I first came across Emma and Kim when I saw an Australian TV documentary, The Feed, about Emma's aphasia in 2018. This programme documented how Emma found she could sing in spite of her struggles with aphasia and was introduced to an aphasia choir. I followed Emma's story from then on social media and later through working with Kim when she joined the board of the AAA in 2020. I was impressed by their passion and drive for raising awareness of aphasia. In 2021, when I commenced this PhD, I was a member of the AAA's 13th National Conference Committee, and we invited Emma to be one of our keynote speakers. This conference was postponed from November 2020 due to the COVID-19 pandemic and was planned to be online rather than in person. Emma recorded her keynote speech as a series of videos on her phone, and I was tasked with combining her video content and PowerPoint slides for the conference. During this process, I listened to Emma's story multiple times, and it made a very powerful impression on me, especially when she talked about not knowing she had aphasia for 10 months and the impact that that had on her mental health. Consequently, when it came to considering who to invite onto our team as research advisors with lived experience of aphasia on a project about aphasia awareness, I didn't have to think twice. I reached out to Emma and Kim, and they accepted my invitation immediately. So Emma and Kim were invited to provide advice throughout the PhD, and specifically when designing the studies and before and after data collection. And Emma and Kim were reimbursed for their time. So as I mentioned, Emma didn't know she had aphasia for 10 months after her stroke. It was a relief when she had a name for the condition and knew she wasn't going crazy. This sowed the seed for Emma wanting to spread the word about aphasia. She wants to help others in a similar situation to herself and let the general public know about aphasia, in her words, so that people with aphasia do not feel stupid when they go out. Emma had positive and negative experiences in rehabilitation. Her negative experiences included being told that she had plateaued and that she would not get any better. On discharge home from hospital, Emma's relationship with her fiancé broke down and she returned to live with her parents. This was difficult. She had no friends in that area and she became depressed and suicidal. Emma gradually started building a new life. Fundamental to this was the positive impact of meeting other people with aphasia. She joined the Maitland Aphasia Group, becoming president of the group in 2019. She has also been involved with the Stroke Foundation's Young Stroke Project, the Centre of Research Excellence in Aphasia Recovery and Rehabilitation's Research Partners Group, and a number of other stroke and aphasia research projects. Emma eventually managed to achieve her dream of returning to work in a permanent part-time role, 4 days per week, with the Federal Circuit and Family Court of Australia in 2019. Emma currently works from home, but goes into the office 1 day per fortnight. Emma has described how her mentor helped her get back to work. Her work colleagues have been extremely supportive, but when Emma and Kim gave a talk at Emma's work during Stroke Week in 2021, it made her colleagues stop and think about just how much Emma has had to cope with. Emma regained her driving licence in August 2018, has been able to drive herself to and from work 45 minutes each way since then. She now has her own apartment in her parents' house. Spreading awareness of aphasia is a personal goal of Emma's, and she's already done much to raise awareness of aphasia, including the TV documentary, magazine articles, giving talks at her initial rehabilitation unit, workplace and conferences, social media posts, including the video of her bin challenge, where she wrote, "Aphasia is a loss of language, not intelligence," on her wheelie bin, and it went viral, and her aphasia tattoos. In May 2021, Emma was awarded the Stroke Foundation's National Courage Award. Emma's stroke and aphasia have had a major impact on the lives of her family and friends, and in particular, the lives of her parents, who have done all they can to support her. Emma returned to live with her parents after her stroke, which was a significant and previously unexpected life change for them all. Eventually, they all moved to a larger home where Emma was able to have a self-contained apartment and some independence, but where her parents were still close by if Emma needed them. Kim retired from her job as a school librarian in December 2020, but retirement has been different from the retirement she imagined. As a result of their family's experience of Emma's stroke and aphasia, Kim is also passionate about raising awareness of both stroke, especially in younger people, and aphasia. She also featured in the TV documentary about Emma's stroke and aphasia and has participated in several radio interviews about both topics. Kim has taken up volunteer roles with numerous consumer organisations. These roles include being a board member and secretary for the AAA, a member and current deputy chair of the Consumer Council of the Stroke Foundation, being on the Research Partners Group for the Aphasia CRE, and a consumer representative on the Ethics Board of Speech Pathology Australia. In her role with the AAA, Kim has contributed to many AAA initiatives, including the planning of the 14th National Conference in 2023 and the Aphasia Handbook, developed jointly by the AAA and the Stroke Foundation and intended to be given to every new stroke patient experiencing aphasia in Australia. Kim has also been involved in many research projects about aphasia. All these advocacy efforts have been extremely valued by the stroke and aphasia communities in Australia. Some background about aphasia awareness. So research around the world shows that public awareness of aphasia is persistently low. More than half of these studies reported rates of awareness below 20%. and rates for having basic knowledge of aphasia, such as knowing features or symptoms of aphasia, are also low, with more than half the studies reporting rates below 10%. However, in these studies, the concept of aphasia awareness is inconsistently defined. The majority considered having heard the word aphasia to be awareness, and others, such as the studies by the National Aphasia Association in the USA, considered participants to be aphasia aware if they had heard the word and could identify aphasia as a language disorder. Low aphasia awareness has economic, psychosocial, and political consequences. These include a lack of funding for aphasia services and research, a lack of support and public empathy for people with aphasia and their families in their communities, and fewer opportunities to return to work, education, or to participate in social activities. 25 years ago, Elman et al. Argued for the need to raise awareness of aphasia in order to increase funding and reduce psychosocial isolation. Since then, individuals, local services, and aphasia consumer organisations around the world have gone to great lengths to raise awareness, but despite these efforts, levels of awareness remain low. Researchers identified possible reasons why aphasia awareness remains low. Firstly, campaigns have not had a unified and compelling message. They have not been coordinated across organisations and campaigns, and tend to target people who are already aware of aphasia. Campaigns are not informed by theory or research, and people living with aphasia and healthcare professionals are not always included in their design. Finally, the impact of campaigns has not been evaluated. This paper called for a collaborative international effort to address aphasia awareness and led to my PhD. The overall aim of my PhD was to co-design a unified international aphasia awareness campaign. The first two studies explored international stakeholder perspectives and experiences of raising awareness of aphasia and priorities for a unified campaign. These studies informed the third co-designed study. So study 1 was published in Aphasiology last year, and you can scan the QR code to access the article. This study had several aims. We wanted to know what stakeholders think about aphasia awareness, including how important it is to them and why. The term aphasia awareness is often used but difficult to define, so we wanted to understand what the term means to stakeholders and what they think others need to know to be aphasia aware. We also wanted to understand what stakeholders think an aphasia awareness campaign should do and find out what they had done to raise awareness and what methods they thought were most effective. Finally, we wanted to identify the barriers and facilitators to raising awareness of aphasia. So we ran online international surveys with two stakeholder groups: people living with aphasia and people who work with people with aphasia. Emma and Kim helped with the survey development, questions and response options, and making the survey for people living with aphasia friendly. A limitation of the surveys is that they were in English. Invitations to complete the surveys were sent out by email and social media. We analysed responses from 105 people living with aphasia from 13 countries and 306 workers from 37 countries. This shows where the responses for people living with aphasia came from by continent and country. 59% came from Australia and New Zealand, and there were no responses from South America and Africa. Most responses came from countries where English is the predominant language, but our respondents indicated speaking 11 other languages. 63% of these respondents were people with aphasia, 68% were female, and 75% had had a stroke. 43% rated themselves or their family member as having moderate aphasia, and 83% had been living with aphasia for more than 12 months, with a range from 13 months to 45 years. This shows where the responses from workers came from by continent and country. 41% came from Europe, and the UK had the highest number of responses per country, closely followed by Australia. There was only one response from South America, and although we received more responses from English-speaking countries, our participants indicated that they spoke a further 30 languages at work. 73% of these respondents were clinicians, 90% were female, and 30% had 1 to 5 years experience working with people with aphasia. So, 93% of people living with aphasia and 95% of workers rated aphasia awareness as very or extremely important, and nobody thought it was unimportant. The main reasons why aphasia awareness is important were people with aphasia face barriers to communication and information every day, people don't know how to support communication for people with aphasia, and aphasia affects not only the person with aphasia, but also their family and friends. Both groups considered aphasia awareness meant people know how to communicate with a person with aphasia, people understand the condition aphasia, and educating people about aphasia. To be aphasia aware, both groups thought others needed to know what helps people with aphasia to communicate. Aphasia does not affect intelligence, and the impact on people with aphasia. And both groups thought an aphasia awareness campaign should educate people about aphasia and change the way people communicate with people with aphasia. Only 5% of people living with aphasia and 31% of workers had run an aphasia awareness campaign. The most frequently reported awareness-raising activities were giving talks, social media posts, and displaying posters. Both groups thought giving talks was the most effective way to raise awareness, followed by social media posts and TV interviews. We explored specific details of campaigns. The most common target audiences were the general public, healthcare workers, and family members. The most common goal was raise awareness of aphasia, followed by more specific goals, including how to communicate with people with aphasia and understand what aphasia is and its impact. Key messages included how to support communication with a person with aphasia, what is aphasia, the impact of aphasia, and aphasia does not affect intelligence. The most common messengers were people who work with people with aphasia and people living with aphasia. Most campaigns were carried out during Aphasia Awareness Month, followed by other days or weeks for aphasia and related causes. Over half the respondents had not evaluated their campaigns. Those who had reported using a range of methods such as surveys or questionnaires, engagement numbers, and interviews. We also explored the cost of campaigns and found most had been run on a shoestring, with only 7 campaigns costing more than 1,000 Australian dollars and only 5 costing more than 10,000 Australian dollars. The majority of campaigns received no funding. Where funding was secured, the sources were applied for funding, employing organisations, and aphasia consumer organisations. We explored barriers and facilitators to raising awareness. People living with aphasia reported their aphasia, stigma, and aphasia being a hidden disability, and lacking the confidence to speak were key barriers. Workers cited a lack of time, funds, and resources. They also highlighted a lack of skills, including marketing skills, knowing the most effective communication channels to use, and how to evaluate the impact of a campaign, as well as a lack of interest amongst the general public. For facilitators, people living with aphasia reported telling their story, or being able to refer to a famous person with the condition, and the attitude of others were key. Workers highlighted the importance of people with aphasia and or their families as key members or leaders of the awareness campaign, famous people talking about aphasia, and the attitude of others. The major limitation of this study was that the surveys were only in English, which is likely to have impacted the number of people with and without aphasia able to complete the survey in countries where English is not the first language. It also proved difficult to recruit participants from countries such as Russia, China, Japan, South America, and parts of Africa, where we have no established link with the aphasia community. Responder bias is a further possible limitation of this study. Study 1 has demonstrated that an international online survey is feasible with people living with aphasia, providing appropriate accessibility measures are in place. It has underscored the importance of aphasia awareness to the global aphasia community. And it is the first study to take aphasia awareness beyond numbers and explore what it means to be aphasia aware. This study supports the notion that aphasia awareness is more than having heard the word aphasia or being able to define the term. And this extends the concept of aphasia awareness that was previously used to evaluate aphasia awareness. Our findings support the argument that raising awareness involves challenging misconceptions about and stereotypes about communication disability and providing practical education such as how to communicate with a person with aphasia. This study highlights the importance of defining objectives and outcomes for aphasia awareness beyond raising awareness, and it is the first to gather details of what stakeholders have done to raise awareness of aphasia internationally and to explore the barriers and facilitators to raising awareness. Our results provide further insights into factors which have likely impacted the limited success of aphasia awareness campaigns to date. And finally, it supports the need for an international collaborative effort to raise awareness of aphasia. Our second study has been submitted for publication in Disability and Rehabilitation and is currently under review. So this was another international study, and we were very fortunate to work with these amazing international researchers. The aim of this second study was to reach agreement on priorities for a unified international aphasia awareness campaign across these key elements. We ran online focus groups using a modified nominal group technique to vote for priorities with the same stakeholder groups: people living with aphasia, we had 26, and people who work with people with aphasia, we had 29, in 5 countries: Australia, Colombia, Denmark, Singapore, and the USA. The groups in Colombia were run in Spanish, the groups in Denmark in Danish, and the other groups in English. Emma and Kim helped us to determine the nominal question. The nominal group technique allowed everyone to contribute equally. We showed participants the results of our first study about stakeholder perspectives on aphasia awareness, and we asked them to think about the different elements of an aphasia awareness campaign. Then we asked the nominal question, what are the most important elements of an international aphasia awareness campaign? Participants took turns to answer the question until the group ran out of ideas. We recorded their answers on post-it notes on a Miro board shared on Zoom. We clarified ideas and we grouped ideas together, and we deleted any duplicate ideas. Then we asked participants to vote individually for their top 3 ideas from all the ideas generated in order of importance. 3 points were given to the first priority, 2 points to the second, and 1 point to the third priority of each participant. And this allowed us to see which priorities were most popular within groups and across groups. When we looked at priorities across groups, similar ideas were grouped together. So participants generated 552 ideas, and they prioritised 115 of these. The next slides summarise the main priorities in each element across both stakeholder groups. The top outcome across all groups was prioritised by people living with aphasia in the USA. One day, the world's population will understand aphasia, and all people with aphasia will be treated with respect and kindness. People living with aphasia in Denmark prioritised everyone in the public knows what aphasia is. Other priority outcomes included increased philanthropic funding for aphasia and standard support for people with aphasia across all aspects of society. The most important goal was the reintegration of people with aphasia into society. Do not exclude people with aphasia. People living with aphasia in Colombia prioritised integrate people with aphasia into society. At work, useful things because the intellect is fine. The top priority target audience across both stakeholder groups was the whole world, the general public, the community at large. People living with aphasia in Colombia prioritised the whole world can know about aphasia without exception. Workers in Colombia prioritised everyday people, ordinary people, people without scientific or academic education, for example, drivers of public transport or people working at any front desk job. The next priority audiences were healthcare workers, including medical, nursing, hospital staff and GPs. People living with aphasia in America prioritised all hospital professionals need to be able to care for people with aphasia. The third priority was families and friends. The priority messages were about the branding and marketing tactics for the message itself. Workers in Australia prioritised a consistent message, symbols, logo, language, story, something recognisable to people, such as a catchphrase. Explaining what aphasia is and is not, and its impact on people with aphasia and their family and friends, and how to support communication with a person with aphasia. People living with aphasia in Australia prioritised people with aphasia can contribute and have value with patience and support. For messengers, workers in Australia prioritised using the stories and faces of people with lived experience of aphasia, and this was a top priority for messengers across all groups, followed by celebrities and influencers and aphasia associations. Regarding context, workers in Denmark prioritised a model like the Sunflower Campaign, or linking to something else that already exists, and the need for a repeated, regular or annual campaign was important to both stakeholder groups. Workers in Singapore prioritised cultural relevance and sensitivity. The top three priorities about communication channels were mass media, places where people can't avoid it, where it would be hard not to see it, and a well-planned international hub that tackles it in a coordinated manner. Workers in Singapore prioritised the international community has a common desired outcome and work towards it together. Need to do it together at the same time on top of a unified message. For cost and funding, stakeholders prioritised governments and philanthropists. The main limitation of this study is that we did not have any representation from Africa, despite our best efforts to seek representation. And we acknowledge that this is a limitation when thinking about an international campaign. We also recognise that there will be cultural differences between countries, even within the same continent. And another important consideration when collaborating with others in other countries is the need for methodological consistency between sites. A detailed manual was developed, but this required adherence from the participating sites and communication with the main research team over any queries. Some sites communicated more frequently with the main research team to clarify processes than others. Study 2 demonstrated that online focus groups using nominal group technique are feasible for people living with aphasia if they have the right supports in place. It is the first study to explore priorities for a unified international aphasia awareness campaign and identified priorities across the key elements. This study also supported the notion that aphasia awareness campaigns should provide practical education about how to support communication for people with aphasia. Study 3 is being prepared for publication in Health Expectations. We assembled an international co-design team comprising people with lived experience of aphasia, representatives from national and international aphasia, stroke and rehabilitation organisations, and experts with media, marketing, health promotion and implementation science expertise, all working together as equal team members. We ran a series of 6 online co-design workshops. Our co-designers spanned 7 countries, 4 continents and 8 time zones. To deal with the different time zones, 3 workshops were held per round. Emma and Kim were co-facilitators, and we produced a blueprint and strategy for an international aphasia awareness campaign, not the campaign itself. This is the outline of the co-design workshops, and aphasia-friendly minutes of each meeting in each round were circulated to the whole team between workshop rounds. Really like the dream outcome from study 2, and this helped to determine the target audience, the general public, and helped to shape the message by focusing on what the general public need to know to understand aphasia and treat people with aphasia with respect and kindness. To understand aphasia, the team felt the general public needed to know what aphasia is and is not, and the impact of aphasia. We had lengthy debates around how to describe aphasia and the words that would be easiest for a lay audience to understand. The team settled on aphasia is a communication difficulty. It is due to a brain injury, such as a stroke. It can make it hard to talk, understand speech, read, write, and use numbers. It does not affect intelligence. It's different for everyone. For the impact, the team wanted to stress how communication is central to life. So aphasia can impact every part of life. It can be lonely, depressing, and very frustrating. To treat people with aphasia with kindness and respect, the team felt the general public needed to understand how to respond to people with aphasia. The team wanted to highlight that changing how people communicate with people with aphasia by using a few simple strategies has the power to change lives. Talk to them. Speak slower and clearly. Use simple words and short phrases. Give time and listen. Don't interrupt, and keep trying. The team wanted several calls to action, including learn more, spread the message, and an aphasia challenge or simulation to give a sense of what it is like to have aphasia. They came up with the tagline, recognize, respond, respect. The team wanted a suite of downloadable digital campaign materials. They felt the message should be aphasia-friendly, and this would make it accessible to a wider audience. They wanted the same branding on all materials, and for them to represent all ethnicities, ages, and abilities. They wanted all animated characters to look human, but they debated whether the character with aphasia should be in a wheelchair or not, as this might weaken the focus on aphasia. The plan to operationalise the campaign had several steps. First, seek funding to develop the campaign materials, translate the campaign materials into different languages, keep all the materials in one central place, identify campaign champions in different countries to distribute the materials and report back on the reach, set a launch date, have a lead up to the launch to maximise engagement, launch the campaign globally at the same time, and evaluate the campaign. Future directions include seeking funding to co-develop the campaign assets, partnering with key organisations to support translation of the campaign assets and recruit campaign champions, and engaging the support of the global aphasia community to help spread the campaign and evaluate the campaign. So the limitations of Study 3 include limited funding meant we could not reimburse professionals with specific skill sets, such as media and marketing, and this precluded some from joining the team. Consequently, it was very challenging and time-consuming to find people with the desired skills. Another significant limitation of this study arose from our team members spanning 8 different time zones, making it impossible to find a single time when the whole team could meet together. To address this problem, 3 meeting options were offered per each round of workshops. This enabled more in-depth discussion, but made it challenging to know if all team members were aware of everyone else's opinions and to reach agreement on key points. Group dynamics also had a part to play, with more dominant voices influencing some meetings and discussions. To address these issues, aphasia-friendly minutes of all meetings in each round were shared with all team members to try to make the discussions from all meetings accessible to all team members. While time-consuming to produce, these minutes also allowed key points to be reiterated in subsequent rounds of workshops. Although the results of Studies 1 and 2 were presented to the team between the first 2 rounds of workshops, the findings were not necessarily well remembered by all, especially over a 6-month time frame. And a further limitation of this project was that the workshops were conducted entirely in English and the minutes were in English, which added a further layer of complexity for our co-designers for whom English was not their first language. Finally, it may have been beneficial to have additional skills represented on the co-design team. For example, a representative with global media and marketing expertise who could advise on global implementation, and an animator who could provide further insights about how the campaign assets could be adapted for different ethnicities and cultures. But as previously mentioned, funding was a barrier to this. Learnings and key messages from Study 3. Firstly, the co-design of an international aphasia awareness campaign based on international research has not been attempted before. So this study drew on data from 40 countries and 6 continents, and it included experts from disciplines beyond speech pathology, including media, marketing, and health promotion, but was not without its challenges. Running online co-design workshops was a feasible and cost-effective method of bringing together an international team of co-designers. And beginning with the end in mind and establishing the outcome first guided the rest of the campaign. This study underlines the challenge of explaining the complexity of aphasia in a succinct way suitable for short campaign assets and supports the need for a standard definition of aphasia, which includes the impact of aphasia on people with aphasia and their families and friends. I would like to share some reflections on Emma and Kim's involvement as research advisors with lived experience of aphasia in this PhD. Emma was excited to be involved in the design and development of the studies and surveys and see this gain a global reach. She found it exciting to have such a wonderful team with varied experiences to help design the campaign, and she enjoyed meeting other young stroke survivors with aphasia from other countries and working with people who inspired her and gave her hope. Kim enjoyed being part of this process and meeting the other co-designers online. She found it a lovely experience and hopes to meet the co-designers in person one day. Kim found it beneficial to meet other aphasia survivors from around the world and very informative and educational to meet other stakeholders involved with aphasia around the world. Emma and Kim have contributed and improved this research in multiple ways. In particular, they have allowed me to feel confident that my many project materials were accessible to people with aphasia and that our project plan aligned with the wishes and needs of the aphasia community. They also helped with piloting the surveys, distributing the surveys, recruiting participants for the nominal groups, helping to refine the nominal question, co-facilitating the co-design workshops, and helping to share the results of our work. It has been an absolute privilege to present our work with Emma to audiences of people living with aphasia, such as at the Australian Aphasia Association's 14th National Conference in 2023 and at the International Aphasia Rehabilitation Conference in 2024. Working with Emma and Kim has been a huge highlight of this PhD journey. They have been a great support to me and helped me to keep my focus on why I was doing this work. When I first met Emma in person, she signed a book chapter she had written with the words her pop had said to her when she first had her stroke. Keep on keeping on. And these wise words helped me to do exactly that. The awareness campaign co-design could have gone in many different directions and targeted many different populations, such as funders, community service providers, GPs, and other healthcare professionals, depending on the final desired outcome. The co-design process began with the end in mind and a clear outcome beyond raise awareness of aphasia. The chosen outcome was that one day the world's population will understand aphasia and all people with aphasia will be treated with respect and kindness. This campaign therefore focuses on what the general public need to know to understand aphasia and how to interact with people with aphasia. The final content is not radically different from previous campaigns. It explains what aphasia is, highlights that intelligence is not affected, outlines some key impacts, and includes some simple tips for communicating with people with aphasia. The final campaign itself is ambitious in its scope, and it could be argued to be idealistic. Therefore, it is important to be realistic about the effects it can have. Noor, in 2006, stresses the importance of targeting campaigns and ensuring that they are well executed to have even a small to medium effect on knowledge of health conditions and behaviour. This campaign is targeting the general public on an international level and has not been segmented further. It will likely take time for the impacts to be discernible, but it will provide a foundation for future campaigns. The strength of the campaign plan, however, is the idea of a unified campaign to reduce duplication of effort and resources and provide a clear, succinct message with a combined voice. The overall limitations of this research, the main limitation across studies 1 and 3, as already indicated, was that they were conducted in English. And so this has implications for the final campaign, as the words used may not translate easily into other languages. In particular, the tagline, recognise, respond, respect, may not translate well into other languages. Despite collecting data from 40 countries and all 6 continents, it is clear that the majority of countries were not represented. And furthermore, 22 out of 40 countries were represented by less than 5 responses in the online surveys. Therefore, Although we were aiming to develop an international campaign, is it truly international? Overall contributions of this research are patient and public involvement was integral throughout the research. It was feasible to have Emma and Kim involved and stay engaged for more than 3 years. And this was largely due to their passion for the topic, having an authentic relationship with them, being flexible about meeting times, and being able to reimburse them. It highlights that it is feasible to do rigorous co-design research on an international scale with people with aphasia, with appropriate aphasia-friendly supports, such as PowerPoint slides to guide discussions and to form the basis of accessible minutes. All 3 studies had an international focus, and this work provides an example of the need to work on an international level to tackle international problems. It has redefined what we mean by aphasia awareness, which has implications for future awareness campaigns and studies attempting to gauge levels of awareness. And finally, if the campaign blueprint is successful, it could be used for further campaigns for aphasia and other conditions. I would like to acknowledge Dr. Tanya Rose, who helped plan this project, and our various funding sources. And the picture materials used in this presentation. And these are my references. Thank you very much.
Thank you so much, Claire, for sharing all of that. Certainly an enormous project you've taken on there. What do we have? 466 participants, 40 countries. You sifted through 552 ideas, targeting nothing less than the whole world. And you said 8 time zones, so I can't imagine how much sleep that cost you. So when you say, was it truly an international project? I think, my answer is yes, even if you didn't reach every single country. So well done on this massive body of work. Also extremely novel to have such close involvement of people with lived experience throughout the whole PhD and not just, certain parts of the project. So really good to see. We'll go through
That's a real highlight.
Yeah, and that shows, I think. We'll jump to a few questions. One I had was whether you see this as being sort of a single campaign or whether it could be broken up, because there is quite a bit there that people want to get across, or do you really think it's one campaign?
I think probably one of the deciding factors, John, will be funding and how many opportunities we get to do this. And so we had discussions in our co-design team about whether, the first step was just getting the word aphasia out there and nothing more. But that didn't really seem to align with what the results of our first studies were saying. So I think what we ended up with was wanting something that was quite a tight campaign, quite defined. We had to think long and hard about what information to include and what to exclude. But I think where we ended up, that would be what we were trying to deliver in the first instance. It might be that then we can build on that for future campaigns.
Yeah, so I guess it is, and this is what was wanted, but it's beyond awareness, isn't it? It's really sort of understanding of aphasia, and hopefully the trickle down of that would be that, a lot of the challenges faced by people in the community dissolve somewhat because people understand aphasia and communication.
I think that's what we were really trying to aim at. And when we settled on this very ambitious goal of the general public and trying to make it involve as many different countries and languages as we can, I think the feeling was that, that information should trickle to other audiences too.
Another question, I'll go to the audience questions soon, but do you have a sense of how much would be in kind of the initial public facing, say, tagline, and how much would be behind the QR to learn more about You know, would all of the target information be in, say, a commercial or a social media video, or would it be something to entice them to read more?
I think what is presented to people first and foremost will be quite a simple message, John, and not go into all the different complexities of aphasia. And that is where we had to really think very carefully about what we wanted to include and not include. So an example of that would be, we did want the campaign to be applicable to people with aphasia of any cause. And therefore, as a result of that, we didn't want to dwell too much on the recovery aspects, for example. So I think all those extra details, I think people would have to be directed to either by a QR code or or
no, that makes
through a
sense.
website.
We have a question from Sally Zingelman. Congratulations on developing such a comprehensive and well-needed awareness campaign. I greatly enjoyed your presentation. Will the members of the international co-design team from Study 3 be involved in future plans to roll out the awareness campaign?
Well, one of our strategies throughout with our whole design was involving people from different aphasia organisations around the world, not just aphasia organisations, but stroke organisations. We wanted everyone to feel that they had had some input to this work somewhere along the line. So whether it was from responding to the surveys, or whether it was taking part in the nominal groups, or whether it was in the co-design study itself. So our hope would be that you know people are already invested in this work and would help with the distribution of the assets.
Question from Annie Hill. Congratulations on this amazing project. I agree with John that your project is definitely an international project. What are your options for seeking funding? Could individual countries apply for funding to implement the unified campaign, or do you want it to be a single source of funding for the whole campaign?
Now that's an interesting suggestion, Annie. I think our first plan of attack was going to be to try to get some funding for the whole campaign. But, you know, we might need to have some other strategies up our sleeve as well. And so some of it may just depend on what funding opportunities are available and where.
Another question I had from Rebecca Sullivan was just around an evaluation of its success. Was that, unless that was missed, but you already covered that, but is there a plan for evaluating it?
Yeah, that certainly would be part of it. And where we are hoping to recruit campaign champions in different countries, we would be hoping that they would be able to help with the evaluation as well, by gathering information and feeding it back in terms of, you know, how far the campaign might have reached and what engagement looked like in different countries. So evaluation is definitely a part of the plan.
I guess that's where we need those marketers do their thing and tell us how successful it was. Well, thanks again, Claire, for your time. And the video will be up on YouTube soon. Let me just cover off a few points before we close. So if you do want to revisit today's session or share it with someone else, it will be up on our YouTube channel within a week or two, along with most of our past seminars. And if you wanted to stay informed about the Aphasia Series work, you can follow our blog or Facebook or LinkedIn, and now Blue Sky, which we'll have to add to this page, and you'll receive updates on the CRE. For next month, we will be hearing from Dr. Marcella Caraha, who's a researcher within the Aphasia CRE. So stay tuned for that topic. Thanks, Claire. Thanks, everyone, for attending.
Thanks, John.